Let's turn to delivery system redesign and payment reform. Very much related. Oftentimes people say that, I guess the delivery system, redesign, you talked about what you're doing in Pittsburgh with some of the Toyota principles and lean principles. Presumably that's redesigning a delivery system. Payment reform is trying to get the incentives on the financial side to encourage appropriate system redesign. And then at the end of the day, you got to be able to measure this. So I see these as sort of fitting together. I assume you probably do too, but wanted to get your take on each of these topics. So maybe let's start with system redesign. What do you think are some of the key things that are needed in the Commonwealth? Maybe we can stick there, or maybe some of the key things that you've done in Pittsburgh that you think could be extended out to other places in Pennsylvania or otherwise.
I think when we look at system redesign, there are a lot of models out there. And one of the issues is doing models without there being payment for that model is typically not a successful long-term plan. Now we're in a time when a lot of the major insurance plans and CMS are advancing new models of care, and they're asking regions around the country to test them. The most typical example that people think of is the Accountable Care Network, the Accountable Care Organization, or ACO concept. Very curiously, ACOs have flourished in different parts of the country, but they have not flourished in Pennsylvania. We're fascinated as to why that is. There may be nuances of our structure, our geography, our culture, but suffice to say that at least in Western Pennsylvania, we really only have two prominent medical group ACOs and two hospital group ACOs that are occurring. In places like New Hampshire, there are hospitals that are in 6 or 7 ACOs at one time. ACOs, which are a system where an empaneled group of physicians and hospitals take responsibility for cost and quality of care, are a terrific idea. We're following exactly how the prototypes that have launched are doing. There's another model of care that we've been tracking. That's this idea of bundled payments. Bundled payments is where an episode of care, like a knee replacement or a hip replacement, and all the care around it, the 7 days pre-op and say the 3 months after surgery, are bundled as a unit price. Again, there have been models of bundled payment going on around the country for many years. There were no bundled payment models in Western Pennsylvania, though. Again, it was just a nuance of our region. Because of this, CMS has actually moved forward with hip and knee bundles that are mandated through a project called CCJR that began this past year. So we're doing our best at PRHI to support organizations that are doing some of the mainstream models of care that have been promoted by CMS by the major payers. Mm-hmm. That said, we think there's actually some room for new ideas. And at PRHI, we're promoting a concept called the Primary Care Resource Center concept. And that's that we've been working with community hospitals, finding out why they don't participate in ACOs, why they don't participate in bundled payments. And what we found is they just don't have the scale and the quality improvement resources to do this. So in our PCRC project, which we've been promoting in 7 health systems around the Commonwealth, what we're doing is we're creating hubs that help with care transitions from the hospital to the community and support primary care practices which don't have the resources that they need to meet the needs of their populations. Everything from smoking cessation to access to an outpatient pharmacist, durable medical equipment, end-of-life planning. So this is just one idea that we think that can dovetail with some other federal ideas that may really change the face of Pennsylvania healthcare.
Great.